Welcome to the Personality Couch podcast, where we discuss all things personality and clinical practice. I'm your host, Doc Bach, and I'm here with my co-host, Doc Fish. We are both licensed clinical psychologists in private practice, and today we are continuing our series on schizotypal personality. And in this episode, we are tackling schizotypal subtypes. Specifically, we will take a quick jaunt through history and then unpack Millon's disengaged, apprehensive, insipid, timorous, immobile, and disorganized schizotypal subtypes. But don't worry, because we know that Millon's expansive vocab also makes us scratch our heads. So we will explain what all these mean in detail. So let's hop to it.
Okay, so let's start with a quick reminder of what schizotypal personality disorder is. According to the DSM, there has to be a pattern of oddities, cognitive or sensory distortions, and social deficits. This includes things like excessive social anxiety, social isolation and withdrawal, among other odd behaviors. Now, you can often tell you're working with a schizotypal individual due to their eccentric thoughts, unusual sensory experiences, suspiciousness, and reading into benign events as having personal significance, which is ideas of reference.
Right. Yeah. So the oddities and slight disconnect from reality are evidence of cognitive slippage and puts schizotypals in the pre-psychotic or even quasi-psychotic camp. But importantly, they are not fully psychotic.
Correct. Now, as far as subtypes go, most of the history on schizotypal is actually in regard to schizophrenia and basically like how schizotypal isn't quite schizophrenia.
Yeah. So I think what you're saying is there's not much in the research on subtypes because schizotypal or schizotypal as a standalone disorder, not part of schizophrenia, is a more recent development in the field of psychology in the last maybe like 45 years or so.
Right. And the two that I did find were not really interesting at all, and they don't map nicely onto what we know about schizotypal personality today.
Exactly. And I think it's important to note that all of the schizo phenomena occurs on a continuum of severity, which also fits in with how Millon conceptualizes subtypes into mild, moderate, and severe.
Yes. And with that, let's get into Millon's theory on the schizotypal personality.
Yes. Okay. So schizotypal is what Millon considers a defective structure, meaning on the severity spectrum, the personality architecture itself is at risk of further falling apart. So while Millon uses severity levels of mild, moderate, and severe in his description of all personality subtypes, for the defective structures specifically, the severity shifts. So even at mild levels, defective structures like schizotypal are prone to impairment more quickly than other personalities. But let's break this down just a little bit more.
Yes. So for schizotypal at the mild style level, the personality structure is still intact, but also more impaired and more at risk to fall apart into a more moderate level. Now, we also find Millon's work in this category to be the hardest to understand. I'm not sure that he fully understood it either, and we kind of have a view that he didn't really get schizoids, let alone schizo phenomena.
Exactly. Well, I think our viewers and listeners agree because we did put a poll out on YouTube, and it seems that our schizo-oriented listeners and viewers don't really think that he got it either, even though he's our favorite personality shrink of all time. With schizoids and schizotypal too, we think he kind of missed the mark here. But anyway, so that's mild level, especially for the mild level. But for the more moderate type level, according to Millon's personality theory, this is where we start seeing the schizotypal personality falling apart. So it represents the DSM schizotypal pathology, whereas other personalities don't have disordered dynamics actually until the severe level. The schizotypal and other defective structures, the disorder is actually found at the moderate level. So we've shifted the scale.
Yes, and this is where in psychodynamic, we would call a structurally defective personality organized at the borderline level, or basically flirting with the line of psychosis. So in the borderline organizational level, schizotypals go around in circles, going nowhere before they restart. They have a capacity to regain their wits and function in life, but then they have transient periods of like bizarre behaviors, irrational impulses, and delusional thoughts. So basically reality is blurred, and it's at the disorder level of schizotypal.
This also reminds me of Kernberg, who said that schizotypal personality disorder in the DSM is the, quote, intermingling of the most severe schizoid personalities and the tail end of schizophrenia. So this highlights that borderline space, right? Or what Millon calls that moderate level of dysfunction. But okay, now we move to that severe disorder level. What we actually have here is a disintegrated structure that represents psychosis. So in the DSM, this level is more likely to be found in the schizophrenia spectrum or psychotic disorder section versus the personality disorder section.
So with all of that context, let's dive into Millon's actual subtypes. We have 6 to unpack, each increasing in pathology. So again, Millon differentiates those by 3 levels of severity that we just talked about. The first is the mild level that is closer to normal functioning, and that is what he calls the eccentric personalities. The second level is that middle borderline functioning that he calls actual schizotypal personalities. Surprise, that's where we would find schizotypal personality disorder. Then the third, last level has completely fallen apart out of reality and cannot function well, and that is what he labels the schizophrenic personalities.
Yes. All right. But let's start with the mild eccentric level. So broadly, this mild level personality has maybe 1 or 2 DSM criteria of schizotypal personality disorder, but they don't manifest obvious pathological features. Like they might seem unusual maybe in their ordinary life, especially with things like sleeping, eating, and socializing that just maybe seems like countercultural, but the pathology isn't super obvious. They're not too withdrawn or peculiar, but maybe just a little.
Oldham and Morris refer to the idiosyncratic style as a different drummer nourished by a unique belief system that contributes to an unconventional or even eccentric lifestyle.
Okay, so this is a very professional, zhuzhed up way to say that he marches to the beat of his own drum, basically. Yeah. Okay, so there are these very mild characters that we're talking about that are just a little odd, a little eccentric, but they are still prone to falling apart, but they're not going to be dangerous. So it's important to note here that none of the schizotypal subtypes are dangerous. But, all right, Doc Fish, I want you to tell me about this first subtype.
Yes. The first subtype is the Disengaged Eccentric. So that is a mild schizotypal style that leans more into a schizoid flavor. So their similarity to schizoid can be seen in their passive detachment. So these individuals have difficulty with eye contact. They're often emaciated because they're detached from their bodies and the fuel that it needs. And so as such, the disengaged eccentric doesn't eat consistently and maybe doesn't even feel hunger all the time. Now, also physically, they can come across as strange and maybe dress in like an odd fashion and have unkempt hair. They may have unusual movements or even an odd gait.
Yeah. And then with that, their communication is just a little off, along with their facial expressions. They are withdrawn and uncomfortable around people, but they are observant of them. They live on the periphery of society, just watching. They are actually disconnected from their thoughts or only loosely connected to them. And our opinion is that this behavior is consistent with a more severe schizoid presentation with maybe a couple of schizotypal symptoms.
Yes, I would agree with that. So next we have the Apprehensive Eccentrics. These are mild schizotypal styles with avoidant features and sometimes even dependent features.
Ooh.
Now, what sets them apart is that they have chronic underlying anxiety and are easily overwhelmed. So they are more actively detached out of fear versus passively detached. And they are very much aware of their anxiety and powerlessness.
Very interesting. Yes. And they are insightful into their tension and also the inability to handle it. Mm-hmm. So they're aware of the conflict between this desire and need for relationship juxtaposed with their intolerance of people. So then they feel trapped in this conflict since they can't handle it. So they choose to detach and actively avoid fearful things, especially socially.
So this is likely going to be an odd and eccentric, avoidant-like character. Then you can see the dependent flavors pop up in their need for people, but then they pull away in like a counter move.
Ooh, yeah.
Mm-hmm. But now let's take it to the next level of severity, which is where the DSM schizotypal personality disorder sits.
Yes. Okay. So at the moderate level, schizotypals experience notable psychotic breaks occasionally, blurring reality and non-reality, but they do not live in the land of psychosis. Their previous coping skills stop working and they don't feel secure, resulting in frantic efforts to keep themselves together. But it can actually come off as like super bizarre because eccentricity doesn't fit well into society. There is a high likelihood of the mild types sinking into this level, this moderate level, with more fragmented, haphazard, estranged traits that definitely don't fit into cultural norms and systems. That downward spiral is gradual but persistent.
Yes, unfortunately so. They are definitely at more of a risk to fall apart into psychosis.
So in this schizotypal personality disorder range, we have the insipid schizotypal, which is a schizotypal personality core with features of schizoid, though sometimes there can also be flavors of melancholic and dependent personalities. So they really lean into this passive detachment, similar to schizoids, being behaviorally idle, socially unengaged, cognitively bankrupt, meaning there's nothing there, and just overall unexcitable.
Cognitively, there's often a tiredness, blocking of thoughts, difficulty concentrating, sensitivity and illusions with sensory stimuli, and obscure thoughts. Mm-hmm. Then emotionally, there seems to be deficits, and they can appear like indifferent, passive, and unmotivated and insensitive to others' feelings. Behaviorally, they are flat, showing little expression, maybe sloth-like. There's a slow down pace to life. And socially, they can be oblivious to social cues and other people's emotions, which then results in facial expressions that are not necessarily appropriate to the situation. As well as speech that might be mumbled, monotone, boring, or just showing some type of cognitive slippage.
Yeah, I can see that.
And then their communication often reflects confusion, odd ideas, circumstantial thoughts, and or just limited responses.
Yeah, so then other people view them as strange, kind of like drifters in the background or on the fringes of society. And they come across as navel gazers. So basically just absorbed in their own thoughts, right? Just oblivious to the outside world. And then they experience such a split between their mind and body that they fear losing the self, of not existing and of falling apart into nothingness, being a robot with no meaning or purpose. So they fill the emptiness with power and significance from brief psychotic experiences involving introspective ideas. So they grasp at anything, real or fantasized, to convince themselves that they do exist. Whoa.
Yes, like that feels like a very key point. So it's an internal passive psychosis, like bizarre telepathic powers or specialness, whereas timorous schizotypals are more actively bizarre in psychosis, but more on that in a minute. So that specialness in the fantasy reminds them of their relevance.
So fascinating. Yeah. So they can enter psychosis through multiple access points, sometimes due to a low threshold for stimulation, which then results in overstimulation easily. And then when overstimulated, it can force them to act out briefly. This energy output can actually lead to psychotic thought processes.
So if we paint a picture of this, let's think of maybe sticking your hand into a dog's cage. They might snap at you or maybe hide in the corner. So an insipid schizotypal is going to snap at you, but that energy expenditure can actually lead to like barking their heads off, and quite literally they can kind of lose their mind and go into psychosis.
So interesting. Yeah. But then conversely, this is the second access point. They can also just quickly detach due to not enough energy or grounding, allowing themselves to cut off the external completely and then fade into non-reality, right? So here's these two reactions, overstimulation or slow fade, leading to potential psychosis in this insipid schizotypal.
Yes. And then I also love this quote. Okay. So the insipid schizotypal occasionally experience the awesome terror of feeling dead, non-existent, petrified, detached from the world, and insensitive to their own feelings. On rare occasions, these patients may become terrified by a frightening sense of nothingness, of passing through a barren, cold, lifeless existence. The disaster of losing self, of becoming a walking robot, a petrified object without meaning or purpose, may overwhelm these patients, driving them into a bizarre psychotic state.
Oh my goodness. How interesting is that? Wow. Okay. All right. So I'm just trying to pull this all together now. So in psychosis, for example, they can enter a world where their telepathic powers maybe make them heroic, right? Giving them meaning and then soothing that fear of becoming nothing. So there's like a grandiosity in their psychotic powers that keeps them from that nothingness and from death. Like, whoa. That is so fascinating.
I think so too. I do. So they often feel as though they are slipping into nothingness, and they will do anything to confirm that they are alive and real. So the odd quirks and eccentric behaviors are essentially ways to forestall the void of oblivion and nothingness.
Wow. Okay, so to keep psychosis from happening, basically. Yeah. And you can see the neuro piece here, the slippage, right? So the mind is slipping in and out of reality. And it's like a CD or like a record that keeps skipping, right? The odd behaviors and mannerisms are the skipping CD or record. And it's the brain malfunctioning, trying to tell itself that it's alive. I mean, whoa.
Yeah, exactly. Okay, so that's the insipid, but then we have the timorous schizotypal, which is a schizotypal personality core with features of avoidant personality. So they are restrained, isolated, apprehensive, suspicious, guarded, and shrinking back or like turtling in. And this is still at the schizotypal personality disorder level. Now, unlike insipid schizotypals who reportedly lack sensitivity, timorous schizotypals' apathy stems from attempting to push down their hypersensitivity in order to protect themselves from the pain of life and relationships, especially because they've learned there's little hope of obtaining security and affection.
Wow.
So, yeah, they can even abandon their own feelings, desires, impulses, and needs. So their isolation is twofold. They can't find comfort in others, but they also find no refuge in themselves, only shame, despair, and a devalued sense of self.
Oh, wow. Yeah. So they intentionally substitute fantasy for rational thinking to avoid the pain of realistic thought. But society doesn't accept that. So they are often shamed back to reality. They start to insulate themselves behind armor, pushing down their sensitivities until there is emptiness and unreality, similar to the insipid schizotypal's fear of non-existence. But instead of the insipid schizotypal's passive detachment from fear of non-existence, the timorous schizotypal seems to actively fill the void with excitable, bizarre behaviors, speech, and hallucinations, all in an attempt to reassure themselves that they are indeed alive, right? Which doesn't work in the long term. So then they turn to fantasy, superstition, magic, telepathy, etc. to obtain a pseudo community of fantasized persons and objects to which they can safely relate.
Mm-hmm.
Whew.
Yes. So basically, they're creating a supportive relational group in their fantasy to meet their own attachment and emotional needs.
So fascinating. Yeah, that's a pseudo community. Yeah.
Yes. So kind of to sum this up, insipid is passively detached and ignoring their needs. They're disconnected and have low energy. So we see more of the negative symptoms of schizophrenia, like low motivation, slower pace, and disconnection. Timorous use their anxious energy to push away from themselves and others. They can be psychically activated by this energy that pushes them into experience of more like the positive symptoms of schizophrenia. So more in line with delusions and hallucinations.
Ooh, that is so fascinating. Yeah. All right. But we do need to look at the most severe level of schizotypal, which is the schizophrenic severe disorder level. All right. So there's a small percentage of moderate level schizotypals who can avoid regressing into the schizophrenic level due to medication, counseling, and family support. But the moderate level schizotypals often fall apart into psychosis if their efforts, resources, and coping skills keep failing, and they just abandon their attempt to stay lucid. The severe schizophrenic disorder is where we find actual schizophrenia because we are at a clear psychotic level. There is consistent, pervasive impairment, and they can't take care of themselves or fulfill societal roles. Usually, inpatient or institutional care and treatment is needed.
Mm-hmm. Now, notably, the moderate levels look more alike as they decompensate, making the subtypes more difficult to differentiate.
That is really interesting. So as the personality starts to fall apart, the subtypes start to look quite similar. Once the personality splinters and fragments, it's harder to find where they fell from or disintegrated from. Yeah. All right. But let's get into these severe schizotypal subtypes, which are really the different flavors of schizophrenia.
So the first subtype in the severe schizophrenic range is the Immobile Schizophrenic, which is a schizotypal core with schizoid features. They're lethargic, indifferent, apathetic, listless, and stuporous, maybe with drab clothing, a lifeless or mask-like face, and maybe like slow labored and whispered or inaudible speech.
Wow.
So their schizoidness means that there are more negative symptoms like loss of pleasure and possibly even loss of movement. They are so passively detached that they seem or even are unresponsive to their environment or pain, or maybe just like automatically obedient despite consequences.
Wow.
So there's a protective withdrawal to avoid the anguish of life.
So interesting. Okay, so here we see the negative symptoms of schizophrenia represented, right? So they can seem vacant or barely verbal. Like everything is just drab. Speech is drab, clothing's drab, motivation is drab to nil, really. They just kind of exist. And if catatonia is present, it's often seen through movement, the senses, memory and cognition, emotions, and judgment. So let's break that down. A few examples of what that could look like, catatonia specifically. So emotionally, it can look like chronic agitation or irritability, but without any external input or known reason. It also can mean a rigid body position called catalepsy, and the body can be moved into different positions by a third party, and they rigidly keep that position almost like you're working with clay and can sculpt them.
Mm-hmm. Now, sometimes it's keeping a facial expression rigidly or tensing, grimacing, or keeping a rigid smile regardless of the situation. And then there can be echoing others' words or movements or stereotypical movements. So like repeated motions that don't have a purpose.
Yeah, it can mean acting in an excited or hyperkinetic manner with behaviors like pacing or mimicking others, but without real goal direction. Now, conversely, it can mean withdrawal or hypokinetic catatonia, where there's a total disconnect from the world around them. The person is conscious, but unresponsive to their surroundings, including bodily needs such as eating and urinating. It can also be a mix of these things, and essentially, they can appear near vegetative.
Mm-hmm. Now, I also can't help but think of the previous schizophrenia subtypes. Now, we don't have them in the DSM anymore, but there used to be a catatonic subtype, and I wonder if the immobile schizophrenic would fit there.
Very, very possible. Yes. And
Perhaps.
These were coined like when there were still subtypes of schizophrenia.
Makes sense. Okay. Mm-hmm. Okay. But let's move to the last of the severe subtypes. So this is the disorganized schizophrenic, and that's a schizotypal personality core with avoidant features. Okay. So they seem lost, scattered, and confused, often even being unclear as to like the time, place, and identity. Their behavior and emotions are contradictory and unbalanced, so they can portray odd movements, mannerisms, and posturing, as well as behaviors like grimacing and inappropriate giggling. They can even exhibit regressive behavior, such as discontrol of their bladder and bowels, and eating in a manner that is childlike and ravenous.
Wow. So you can see the disorganization here in the examples. Like it's a bit chaotic, right? So the disorganized type is out of touch with reality and haphazard, versus in the immobile type, they're near comatose. So in other words, disorganized schizophrenia is an active, chaotic subtype versus the immobile is a passive, detached subtype.
Yes, I really like how you distinguish that.
Yeah.
And that brings me to their avoidantness means that they are more actively withdrawn, which includes more positive symptoms such as delusions and hallucinations.
Ooh,
so their thoughts and ideas are not logical or functional, but fragmented, diffuse, scattered, and disorganized, which is totally fascinating. Like even their delusions are incoherent and illogical, unlike other psychotic disorders where their delusions are coherent.
Oh, wow. Okay, so their delusions aren't even logical, meaning you can't follow it. Versus with other disorders, like even at the most severe level, their delusions are often cohesive and elaborate. But here, the delusions themselves don't make sense. Like they're just chaotic.
And then within that, they can't distinguish between what is relevant and what is irrelevant. And so basically, they experience all incoming stimuli and responses equally, which then results in an equal possibility of any and all outgoing expressions. And so then it might be an inappropriate one.
Oh my goodness. Yes. So if you can imagine responding to all input, like I'm going all brain science here for a second, but I wonder if the hypothalamus, the relay station of the brain, gets flooded and then the brain shorts out because the system is flooded.
Possible.
Wow.
I don't know. But this results in communication that is chaotic, irrelevant, and just a mismatch of incoherent word salad.
Ooh.
Interesting stuff, Doc Bach.
It is. Oh my goodness. So this is really deep personality stuff. And I know with our schizoid series, we have found a lot of schizoid oriented listeners and viewers, which we've loved. We've loved the questions. And if you have questions like about schizotypal or about any of the disorders, feel free to ask. We love responding to our listeners and viewers. You can find a form on the website that you fill out or a link to a form, or you can just comment on YouTube. We're happy to answer those questions. But schizotypal is a hard one to really kind of wrap our heads around because it is in that quasi-psychotic place, which is just a really kind of interesting way to live that I think a lot of people might have a hard time understanding. But for those who do or who live in that space, this stuff is really important. And it does remind me that last episode, we put out a poll to see if some of our listeners and viewers have experienced a psychotic episode or even a quasi-psychotic episode. And at the time of this recording, I think of the people who responded, it was like 40% said yes. That describes me. So it's really, really important to to understand this personality type as well as others that are in that quasi-psychotic space. So anyway, let's bring this to a recap. So we learned that schizotypal is an unstable structure that is already prone to backsliding closer and closer to psychosis. So at mild levels, it can look more like schizoid or avoidant personality. And then at that moderate level, we're in personality disorder territory. So we are cycling in and out of reality. And at the most severe levels, we are in full-blown psychosis with evidence of schizophrenia. So here, hospitalization and higher levels of care are likely.
Now, putting in a little nugget, schizotypal personality is a defective structure, meaning it's more severe and can disintegrate into psychosis. So Millon lists schizotypal, paranoid, and borderline personalities as defective structures. So these personalities are structurally important to understand in comparison to other personalities like schizoid and avoidant. And then in our next episode, we're going to dive deeper into this concept of being structurally defective or like falling apart, like closer to psychosis. So you don't want to miss that one.
Exactly. Yes. And on that note, that's a wrap. So thank you for joining us today on this episode of The Personality Couch. Make sure to check out our blogs that coincide with these episodes at www.personalitycouch.com, especially if you're a visual learner with these complex topics. And as always, don't forget to give us a thumbs up or rate and review us on your favorite podcast app. And on YouTube, hit that bell so you don't miss a single episode in our Schizotypal personality series. Be well, be kind, and we'll see you next time on The Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.